Hi friends, good evening. I'm Dr. Ashutosh Gupta, and today we are going to discuss about the interpretation of the serum screenings vis-a-vis with the ultrasound finding, and how do you see and reach to a conclusion by doing a serum screening test. Okay, so we do have two cases which are pole apart. दो केसेस हैं और दोनों में ही ट्राइसोमी या जो कॉमन एन्यूप्लॉइडी की जो रिस्क है वो दोनों में ही हाई रिस्क आ रही है. बट दोनों के जो सीरम स्क्रीनिंग के जो पैरामीटर्स हैं वो बिल्कुल पोल्स अपार्ट है. दूसरा उसमें अल्ट्रासाउंड के जो फाइंडिंग्स हैं वो भी पोल्स अपार्ट है. और वो डेफिनेटली वंस इट इज स्क्रीन पॉजिटिव सो प्रोबब्ली वी हैव डन द एमनियोसेंटेसिस एंड देयरफॉर द रिजल्ट्स आर आल्सो poles apart and they're different, right? So we shall discuss both these two cases. ये फर्स्ट केस है. So beta CG mom values are 2.6, which is high, right? And therefore it is turning out to be screen positive for trisomy 21, लेकिन pre-eclampsia के लिए भी positive है. On an ultrasound, the NT is normal, right? And once we see the baby on an ultrasound, we can identify that very good nasal bone is there, right? On biometry, what we are identifying that there is no growth lag and we are not dealing with any short long bones. This is the case 2, low PAP-A. PAP-A की value काफी कम है, and therefore it is turning out to be positive for trisomy 21, right? But on an ultrasound, if we see the NT is 2.1, which is slightly higher. And then once we are seeing this baby at 16 weeks, we are identifying this ecogenic bowel. Okay, so this ecogenic bowel is eventually it is a grade 2, but it is sinister. It is not normal. And then we are trying to look around for the nasal bone, so we are not able to identify any of the nasal bone, right? So we are discussing about these two cases. These two cases were being referred for an amniocentesis. But before doing this amniocentesis, what we have done is this: we have done a ground check, and then we have looked around how the babies they fare on an ultrasound. Right? Whenever the beta HCG is higher, we have identified that it turns out to be false positive. And then if we have looked around into the ultrasound, we have identified that a very good nasal bone is there, and then we are not identifying any growth lag. Right? Eventually, the amniocentesis has been done, and which turns out to be normal. In a case 2, the PAP-A values are low. Vis-a-vis, we identify that the NT is slightly on higher side, which is 2.1. And on an ultrasound, before doing the amniocentesis, we have identified that we are identifying some ecogenic bowel, and the nasal bone is not being visualized, right? This case also undergone an amniocentesis, and it turned out to be positive for trisomy 21, right? So meaning thereby whenever we deal with the double marker has two values. One is a beta HCG and second is a PAP-A. Whenever the beta HCG values are slightly higher, meaning thereby once they are greater than a 2.5 moms, or a PAP-A value which is low or less than 0.4 moms, so this they could be land up, or they could be harbinger sign for a trisomy 21. Right, but in the case of a beta HCG, what we've identified is this that could be a false positive for trisomy 21, while on the other hand, the low PAP values they might be a sort of an signaling. They could be a sign for a true positive Down syndrome babies, which has happened in our case, right? Okay, so this is how we put across everything together: serum screenings, NT, ultrasound, and the finite test by doing the amniocentesis. Okay, thank you very much for your patience.